Hello everyone. Today on The Secrets to Healthy Living, we will uncover a condition that is quietly attacking millions of people in America, fatty liver disease. Did you know that in the US alone, more than 80 to 100 million people suffer from this condition? Even scarier, 30 to 35% of those have a high risk of progressing to cirrhosis, one of the most dangerous liver diseases. But are you sure you're safe? Do you think only overweight people get fatty liver disease? Think again. Fatty liver disease can happen to anyone. Whether you're skinny, young, or even if you don't drink alcohol. We often believe that our health is fine. But no one can be sure that their body is free from this disease until it's too late. And once the disease progresses, you might face the unimaginable consequences of cirrhosis and liver cancer. What exactly is causing your liver to become fatty? It's certainly not just due to an unhealthy diet or lack of exercise. There are other factors you might not even realize. Habits that seem harmless but are silently destroying your liver. So, how can we prevent and treat fatty liver disease? You can change the course of your life just by making small changes in your daily routine. Keep watching to learn how to identify this disease early and the most effective methods to protect your liver from the dangers lurking ahead. Before we dive into the details, if you find this video helpful, don't forget to subscribe to The Secrets to Healthy Living to support us and motivate us to create more useful health videos. And before we continue, I have a question for you. Do you think you're at risk of fatty liver disease? A. Yes. Because I have some risk factors. B. No. I feel perfectly healthy. Please leave your answer in the comments below so we can reflect and discuss this issue together.
The secrets to healthy living. Strong body and mind, long-lasting life.
Part 1. Risks and stages of fatty liver disease. Fatty liver disease is a silent but extremely dangerous condition. And if not detected and treated in time, the consequences can be severe. In the early stages, the disease often shows no obvious symptoms, leading many people to be unaware of its seriousness. This negligence and lack of awareness have caused many to overlook the initial signs. And by the time the disease progresses, the liver has been severely damaged, resulting in complications such as cirrhosis or, worse, liver cancer. What makes fatty liver disease particularly dangerous is that it doesn't only affect obese individuals, but can also occur in people with normal weight, those who don't drink alcohol, or those who live relatively healthy lifestyles. Fat can accumulate in the liver without showing any obvious signs, causing the patient to remain unaware of the severity until the disease reaches a later stage. Once the disease progresses, treatment becomes more difficult, and in some cases, irreversible. Fatty liver disease is the accumulation of excess fat in the liver, impairing its normal functioning. Although the liver can store a certain amount of fat without harm, when fat exceeds 5 to 10% of the liver's weight, it leads to fatty liver disease. Although there are no obvious symptoms in the early stages, the excess fat already significantly impacts the liver's function. This excess fat can develop over time, causing increasingly serious damage, with unpredictable complications. Fatty liver disease is divided into 3 main stages, each with different symptoms and risks. Stage 1. When fat in the liver accounts for 5 to 10%, typically shows no obvious symptoms, and patients often don't realize they have the disease. However, this is the stage where, if detected and treated in time, liver recovery is completely possible. If left untreated, fatty liver disease can progress to more dangerous stages. In stage 2, when fat in the liver accounts for 10 to 20%, this condition begins to affect liver function. Patients may start feeling tired, have indigestion, or occasionally experience digestive issues, but often do not associate these with the liver. At this stage, treatment becomes necessary, and it is crucial to change lifestyle habits and diet to prevent further progression of the disease. In stage 3, when fat in the liver exceeds 25%, this is the most serious stage of fatty liver disease. This condition not only damages the liver but also increases the risk of cirrhosis and other severe liver diseases. Without timely medical intervention, patients may face irreversible complications, including liver cancer. Therefore, by this stage, treatment is urgent and cannot be delayed any further. Detecting fatty liver disease at different stages and providing timely intervention is key to preventing the serious consequences the disease can cause. Therefore, even if you don't have obvious symptoms, never underestimate your health. Fatty liver disease does not spare anyone. And it doesn't only occur in obese individuals or those who drink alcohol. We all need to pay attention and protect our liver starting right now. Part 2, Causes of Fatty Liver Disease. Fatty liver disease is not a simple or rare condition. And it can occur in anyone, whether you have a healthy body or not. There are many causes behind this condition. And one of the most important factors is metabolic disorders. Obese individuals, especially those with high cholesterol levels, are more likely to develop fatty liver disease. Excess fat in the body not only accumulates under the skin but also infiltrates the liver, forcing it to work overtime to process these fats. This reduces the liver's ability to function normally and causes long-term damage if not treated early. Conversely, those who are malnourished or have a diet lacking in essential nutrients are also at high risk of developing fatty liver disease. Although nutrient deficiencies may not always be obvious, they directly affect the process of fat metabolism in the liver. When the liver doesn't have enough nutrients to maintain its crucial functions, fat accumulates more and more, leading to serious damage over time. In addition to metabolic factors, one very common cause of liver damage is alcohol consumption. When we consume alcohol, the liver is responsible for processing and metabolizing it. However, when consumed excessively, the liver cannot handle the alcohol load, leading to the accumulation of fat and toxins in the liver. Alcohol damages liver cells, preventing the liver from functioning efficiently, and promotes the formation of scars in the liver. This can eventually lead to fatty liver disease and, ultimately, cirrhosis. Another overlooked cause is medications. Some drugs, such as those used to treat HIV, thyroid disorders, and even certain antibiotics like tetracycline, can cause liver damage. These medications not only affect the liver's ability to metabolize substances but also increase the amount of fat stored in the liver, leading to impaired liver function. Apart from these factors, underlying conditions such as diabetes, cardiovascular diseases, or high blood pressure also act as risk factors for fatty liver disease. Diabetic individuals often have high blood sugar levels, which increases the amount of fat in the body, subsequently putting pressure on the liver. Cardiovascular diseases and high blood pressure also increase the risk of this disease due to changes in circulation and fat levels in the blood. When fatty liver disease occurs, early stages typically don't have clear symptoms. Patients may feel tired, lose their appetite, but often don't associate these signs with liver problems. However, as the disease progresses, symptoms become more apparent. Pain in the upper right abdomen is a common sign when the liver starts having issues. Patients may experience indigestion, itching, or dark urine. In some cases, patients may notice yellowing of the skin and eyes, a warning sign that the liver has sustained significant damage. To accurately diagnose fatty liver disease, the best method is through liver ultrasound and a test called fibroscan. This is an accurate tool to assess the severity of the disease and the level of liver damage. While liver ultrasound detects fat accumulation, fibroscan measures the liver's stiffness, allowing doctors to assess the severity of fatty liver disease. Therefore, don't wait until severe symptoms appear. Regular liver checkups are crucial to protecting your health. Part 3, Prevention and Treatment of Fatty Liver Disease. Fatty liver disease is not a simple condition, and it can progress through several stages. In the early stages, fatty liver often doesn't cause many noticeable symptoms. The fat in the liver accounts for a small percentage, 5 to 10% of the liver's weight. and patients typically don't require special treatment at this point. However, at this stage, it is extremely important to change one's diet and lifestyle. A diet low in fats, high in vegetables and fruits, will help reduce the liver's workload and limit the accumulation of excess fat. This is a critical opportunity to adjust one's lifestyle before the condition becomes more severe. If lifestyle and dietary habits are not changed, fatty liver disease can progress to the second stage. At this stage, the fat in the liver makes up 10 to 20% of its weight, and liver function starts to be affected. Patients may begin feeling fatigued, having indigestion, or loss of appetite. This is the point where treatment must be started, and regular monitoring is necessary. Changing the diet, exercising regularly, and taking medication, if needed, will help halt the progression of the disease and reduce the risk of complications. Don't let the disease worsen without timely intervention. When the fat in the liver exceeds 25% of its weight, the disease enters the third stage. This is when the liver can suffer significant damage if not treated in time. Liver cells may become scarred, reducing liver function. Without effective treatment, this can lead to cirrhosis, a severe condition that can lead to liver failure. By this stage, treatment can only help control the disease, but full recovery of liver function is unlikely. Finally, if the disease is not controlled at this stage, the liver may continue to deteriorate and develop into liver cancer. This is the most severe consequence of fatty liver disease, with a high mortality rate. Therefore, early detection and treatment are crucial to treat fatty liver disease. A healthy diet is the first step. Limiting fried foods, processed foods, and increasing vegetables, fruits, and high-fiber foods will help the liver recover and function better. Additionally, gradually losing weight and avoiding rapid weight loss is very important, as sudden weight loss can further damage the liver. Regular exercise is also an effective method to burn excess fat and improve liver health, with light exercises like walking, swimming, or cycling being ideal. Finally, certain medications like vitamin E can help treat fatty liver disease. But medication should only be used under the guidance of a doctor to ensure effectiveness and safety. Remember, the liver is one of the most important organs in the body, and taking care of it will help protect your long-term health. Part 4, Summary and Recommendations. Changing lifestyle habits is an essential factor that cannot be overlooked. A healthy and scientific diet will help the liver maintain its normal function. Limiting alcohol consumption is a crucial step in protecting the liver from unnecessary damage. You should establish a healthy eating routine. Minimize processed foods. Increase vegetables and fiber-rich foods. And maintain regular physical activity. Physical exercise not only benefits overall health but also helps reduce body fat, thereby reducing pressure on the liver. Simple exercises such as walking, swimming, or cycling can significantly improve liver health. The most important thing is to maintain these habits throughout life, as they not only help prevent fatty liver disease but also keep the body healthy and prevent many other diseases. The profound lesson from the above discussion is, health is the most valuable asset, and we are the only ones who can protect and take care of it. We often neglect our bodies until serious problems arise. But in reality, small actions in our daily lives can make a huge difference. Changing eating habits, exercising, and regular health checkups are crucial steps to protect our liver health and prevent dangerous diseases. Remember, every small step in taking care of your current health can help you avoid serious issues in the future. If you have unhealthy habits, don't hesitate to make changes now, as every health-conscious decision will lead to a long, healthy life. Question for you: what do you think about the importance of changing eating habits and physical activity in preventing fatty liver disease? Please comment your thoughts below this video so everyone can refer to them. Don't forget to subscribe to The Secrets to Healthy Living to give us more motivation and keep bringing you helpful health videos in the future.